Now we will go to Pian Huang from National Public Radio from the US. Pian, can you hear us?
Hi, thank you for taking my question. So yesterday, WHO published a paper in BMJ which gives a worst case scenario of 190,000 deaths across Africa in the next year. That's bad, but it's much lower than a worst case scenario of 3 million deaths that a UN report projected last month. So the assumption now is that the virus will spread slower and have a lower mortality rate in Africa. I wanted to ask what has changed in our understanding.
Thanks for the question. I have to admit I haven't read that paper, but a reduction of deaths, but still saying 190,000 deaths is still a pretty high number. And I understand that this is a modeling analysis. And we know that when we do these estimates, these are very important for us to help plan and to help us prepare and to get countries ready for how to build the workforce. How many contact tracers do we need? How many clinicians and nurses and medical professionals do we need? How many beds do we need in particular ICU or oxygen support, ventilatory support, treatment centers, et cetera? And these scenarios that are estimated, the models that make these estimates are really helpful for planning purposes. But we also know that there are tools that we have that we could prevent these numbers from becoming realities. And that's, for me, one of the most critical values of these models is to ensure that we take the right precautions, we put the right emphasis in these interventions where they need to be done so that these numbers do not become reality.
Yeah, and if I could just maybe add, while the numbers in Africa are well below the rest of the world, and as testing rolls out, we may find more and more cases. It's also been clear in other regions that we've seen a potentially long period where the disease establishes itself, and then a particular moment comes when the disease takes off more exponentially. That time is not well determined. But we are seeing, increased activity over the last week in places like Gabon. There's at 153% increase of cases in just a week. Zambia has equally had a large increase in cases. Chad has increased by over 100%. Benin has increased by over 200%. Now, the numbers remain low, but what's concerning is the trajectory, the direction of travel of the curve. So we need to be exceptionally careful at this point not to underrepresent the potential impact of the disease, while at the same time recognizing that we must maintain other essential health services. We must be extremely sensitive to the fact that lockdowns or very extreme public health and social measures aimed at stopping the spread of COVID-19 have a deep impact on lives and livelihoods. So we have to find a balanced strategy that manages the risks of the disease against the risks to lives and livelihood. And that's something that we've said since the beginning. We've been very, very clear. A comprehensive strategy is not a comprehensive lockdown. A comprehensive strategy is a strategy of surveillance, finding cases, testing, isolating, using quarantine, caring for cases, educating communities, providing access to personal hygiene, practicing physical and social distancing where that can be done, and the use of other measures to reduce transmission of infection. It doesn't necessarily mean high-impact lockdowns that shut down society entirely. And I think many countries around the world, but in particularly African countries, are grappling with this dilemma: how to control COVID-19 while maintaining other essential health services. UNICEF have spoken about this and the likely excess mortality in children that may occur unless we're delivering immunisation, unless we continue to deliver food. Henrietta Fore has been very clear on that. David Beasley from the WFP has spoken about the potential issues related to food and hunger as a result of the shutting down of food chains or the loss of food production. So I think in terms of how Africa and African countries deal with this, and again, the Director General may wish to speak, the African Union have very much come together with the comprehensive response plan at the political level. It's great to see that political leadership. I think we're seeing a lot of African leaders step forward, working very closely with our Regional Director, Chidi Muweti, on trying to come up with strategies that are adapted to the social, economic and circumstances of countries. We have issued guidance, very clear guidance on how to adapt the public health control measures that we advise to low-income settings, and we're working very closely with countries at the country level. We have a WHO country office in every country in Africa, and are working with our resident coordinators, the UN system, and with ministries of health and other parts of government to try and ensure that we get maximum control of COVID-19 while preserving essential health services. The Director General has spoken about the potential impact on TB, on HIV services, on immunisation and other things. And this is a delicate balance, and it does require help, it does require assistance. In order to be able to do these two things, governments in Africa need support, they need financing. We thank the World Bank for providing financial instruments and others to help them do that. Every country in Africa now has a government national action plan for the containment of the disease, and we call on all donors and friends of Africa to support those national action plans, to ensure that they're adequately financed, and to ensure that especially vulnerable populations within African countries, particularly refugees and displaced persons, are not left behind in this process.